Dan, you're muted.
Speaker is muted.
Hi again. For those at home who missed this, my long speech, I basically said, welcome. We have people at home, we have people on Zoom who hopefully can now hear me. I want to introduce Dr. Gale Burstein. And this is actually the third time she has spoken to our men's group. The first time was in January of 2020. Dr. Burstein mainly talked about the COVID epidemic and what's being done against it. And not COVID, opioid epidemic. I don't think COVID was mentioned at all that day, even though it was kind of out there. And then 2 months later, bang, it hit. We invited Gale back in, I think it was July of 2020. That was Zoom only, and kind of very much talked about COVID that time. And we are very honored that she is back again. I look forward to hearing what you have to say, Dr. Burstein.
Thank you. Thanks. Well, thanks for welcoming me and allowing me to update you on what's going on in Erie County and public health. So we're going to talk a little bit about COVID, and then we'll talk about some other health problems that have just really mushroomed us during the pandemic, like our opioid epidemics. I had a press conference today about that, our STIs and HIV, and then also just throw in a little monkeypox, even though we don't have any yet. So just for fun. Let's see. There we go. Okay. Sorry, there's a lot of arrows. I had to figure out which one was the right one. So first I'm going to talk about COVID. So this is looking at our COVID numbers. So today there were 408 new COVID-19 cases reported among Erie County residents. So whatever that number is right now, there could be 3-5 times more people that are really infected with COVID. Many people are not testing, and many people are testing at home, and we never find out about that. Even if people do have the opportunity to report onto our website that they tested positive at home, but those do not get entered into the surveillance data. So, so this is, basically 408 is it's a number, a trend that we follow. So so we had almost 2,000, we had about 2,659 cases reported to us in the past week, making our case rate 279 per 100,000 residents. And we've had so far a total of 242,820 cases reported to the Erie County Health Department thus far. And that doesn't include home tests. And it still puts us in a high transmission level, according to CDC. So these are hospital data looking at the total number of people who are admitted to the hospital with COVID-19 from over the past 2 weeks. So starting from May 11th to May 24th on the slide to the left. So the red line are the total number of cases that were people who are tested COVID positive that were admitted to any of the hospitals in Erie County. The green bar is looking at the ICU admissions. The blue line is looking at the number of people who were admitted because they had COVID symptoms. And then the purple line is looking at the number of people who were admitted who had COVID, but were admitted for something else, and they're just incidentally found to have COVID because they test everybody. And so it could be like somebody was having a heart attack and they were admitted for a heart attack and they tested them for COVID and they were COVID positive. So, and then the orange line are the number of deaths. So you can see a trend that we've stayed kind of, on the higher end, about around the average about 200 cases of people who are positive for COVID-19 in the hospitals. I think I can tell you now, about 40% of those people are admitted because they have COVID symptoms. So 60% were admitted for something else. And about 2/3 are fully vaccinated. So that just means they've had 2 doses. It doesn't mean they have been boosted or not. And the reason that you may think like, oh, the vaccine doesn't help, but well, the thing is that really many of the people who are admitted to the hospital, especially for COVID symptoms, are seniors, and most seniors are vaccinated. However, most of the people who get really sick with COVID are also seniors. So it just, that looks like, the population that gets admitted is a population that ends up being fully vaccinated. But again, I don't know what their booster status is. And then the graph to the right is looking at that hospital admissions since March of 2020. So the purple line is looking at all the patients admitted to the hospitals in Erie County, and the blue line is looking at the people who are in the hospital who were admitted to the ICU. And remember, these are people admitted to Erie County hospitals. We don't know if they're Erie County residents or not. Probably most of them are, but there can be people from Niagara County or other outlying counties. So the approach that we have in public health to COVID-19 is really a like multi-strategic approach. So we really, we have a lot of tools that we know of to prevent, to prevent infection and illness. So, we're all masking. Hopefully many of you have been vaccinated and boosted. Many of you are distancing. So, we all have these tools, and if we just relied on any one tool, like, it's not going to prevent 100% of infections. So it's like each intervention is like a slice of Swiss cheese, because although it is a partial barrier, there's still holes and there's still opportunity for COVID-19 transmission. And that's why we have to like pile up all these slices of Swiss cheese on the top of each other to cover all those holes. So if we continue to mask, especially when we're indoors in gathering other than our pod or our close peeps, and we fully vaccinate and get as boosted as possible, and hopefully distance when we're in public places, and make sure that if you're sick, stay at home and get a test. And now we have antivirals that can treat people. We have pre-exposure prophylaxis, Evusheld, that can keep people relatively well, even if they get infected. So we have a lot of different possible interventions. And so we really have to rely on like everything that we have to try to stay as healthy as we can during this pandemic. And so one thing that this pandemic has really brought to light is health disparities. So we know that the people that are suffer from health disparities because of the poverty and neighborhood and education have really suffered during this pandemic. I mean, they've that population unfortunately has done worse than the rest of the county. And it's really it's because of the situation. So a lot of these individuals are like frontline workers, like worked in grocery stores, or like you had to work in the hospital and like couldn't stay at home and didn't have a job where they can work from home. And like they a lot of people in poverty, people who live in poverty, like they're not going to have a big house where, yeah, I'll isolate, I'll go to my part of the house or my bedroom and use my bathroom, and you all don't have to worry. Like whole family would share like one room and one bathroom, and so it's really difficult to isolate and quarantine or physically distance. And then for a while, like diagnostic testing was really hard to come by. And so when people got sick, they didn't have the opportunity to get to a place where there was testing. And then getting access to, to treatment can be difficult. Many people who are suffering from health disparities, don't have a primary care doc, so it can be difficult for them to, to get call somebody up or message them and say, I have COVID, I need some help with antivirals or monoclonal antibodies. And then also access to vaccination can be difficult, and then just access to general health care. So this, really the pandemic has really brought to light our health disparities. But on the other side, it's really given us the opportunity to examine these disparities and figure out how to fix them. And I think we've worked really hard to try to address a lot of these disparities. So, trying to make lemon out of lemonade. So what our role in the health department is, there's a lot of balls that I'm juggling at the same time. So we've had campaigns and we're still doing, diagnostic testing. Now we have a new program that I'll describe in a minute, that test to treat. So if you test positive for COVID at one of our sites, we will, you're interested in getting a prescription for antivirals, we can do that for you if you're eligible. We've been doing the contact tracing all along, the case investigations. We've had vaccine campaigns, and we're still offering vaccinations. And then the personal protective equipment distribution, we've partnered with like local jurisdictions and just, and schools and community centers, and have really tried to distribute PPE. So let me talk a little bit more about the test to treat program, because that's relatively new. We've been doing it for about almost 2 months. So as we started in the beginning of April. So like when, we we're really worried that we're going to have these other waves, and we didn't know with this latest wave how we were going to go. And we were worried that, our hospital beds would fill up, and now there was the opportunity for antivirals to keep people out of the hospital and, keep people relatively healthy during their illness. Like, we thought we had to get on board with it, especially since, initially there were many healthcare providers that felt a little bit, this was like outside of their wheelhouse. They didn't feel comfortable, something new, and a lot of providers weren't prescribing it. The urgent care centers were, but again, like health disparities, they don't, urgent care center will not see you if you don't have insurance, or they will not see you if you have Medicaid. So again, there was disparities there. So we thought we needed to step up and have a test to treat program where people tested positive for COVID-19 and they're interested in get treated. We can make that happen. We're actually the only county in New York State that has this program. And actually we were on a call today with the state health department, and they're like, this is awesome. We've got to expand this. And so they're going to throw all this money our way. So that's really good. So just because they realize it, they're like, oh, you figured it out. No one else has figured this out. So they want to support us to grow this. So we'll be, because right now, I mean, our numbers are still high, although they are decreasing. We're trending about, but this last week compared to the week before, we're about 25% less cases. And so we peaked already, and we're decreasing our numbers. However, like we all know that it's just going to be like crazy horrible in the fall, like it is every fall. So we're just trying to get prepared to scale up at that time. So well, right now we have a predominance of the B.2.12.1. I'm not joking. Well, it's an Omicron variant, because the Omicron is 0.2. So this is like, I don't know, a child or a cousin. So what we do is, so people test positive. We're only offering this to people who test positive at one of our testing sites. And we have 2 testing sites. One is on the east side of Buffalo at 608 William Street. So that's on William Street near Jefferson. And then we also are offering this in Cheektowaga, either at our training academy or right next door at the Cheektowaga Senior Center, just depending on where the space is that day. So, both of those places are pretty accessible. So if somebody tests positive, we inform them that there is this test to treat option. There are antivirals that they may be eligible for. And we ask them if they're interested. If they are, we say, well, why don't you call your primary care doc and get it through them, because they know you, and they'll know which is the best thing to do for you. And then, we said, if you don't have a primary care doc, or if they don't get in touch with you within 24 hours, like call us back and we'll give you the medication if you're eligible. So that's been working out well. Not everybody is eligible. Like, you have to, so it's really to keep people who are infected with COVID-19 and at risk, who have mild to moderate symptoms and are at risk of going downhill, to give them this antiviral medication to keep them out of the hospital. So we get a lot of worried, well, people like, somebody that's like 25 feels fine, no other comorbidities, and they're like, want an antiviral, like, sorry, you're not eligible. Or there can be like, there's 2 antivirals there's one that's made by Pfizer called Paxlovid, and that's the more effective. It at least been shown in the clinical trials submitted to the FDA to be more effective to keep people out of the hospital. And then Merck also has an antiviral, and that's not as effective. However, the Paxlovid has like a lot of drug interactions, and so even people that are eligible for an antiviral may not be able to take Paxlovid because of a medication that they're taking. So instead of saying like, sorry, you're out of luck, we at least offer them, the Merck product, because, something is better than nothing. Like 30% is better than 0%. And that was just, that trial that they submitted to the FDA was just on one trial. Like anecdotally, I know that people that have taken the Merck product like did really well and stayed out of the hospital. So, that's what we're doing. And so we will send in a prescription of either antiviral if you're eligible to the pharmacy of your choice that has the medication available. The federal government has a COVID antiviral medication locator. And so we look at that just to make sure that they have that medication that you want, and we'll send the prescription in there. Right now, the federal government is still covering the costs that are not covered by people's insurance. So people who are uninsured or underinsured, they may not get this covered by their regular insurance. The feds will, have a fund that the pharmacies can bill. So, let's set that. So, we're one of the big challenges in this pandemic, for me, has been like all this misinformation. This has not only been a pandemic of SARS-CoV-2, it's been a pandemic of misinformation. And it's like, it's crazy. And then like what the strategy is that like they take like something that they take up, they make up, they take like something, they make up a myth, and then it has like a little bit of truth in it, but it's like totally gone the wrong way, but it sounds like it's true because it has like a little bit of truth in it. And then people like believe that, and then it's spread on social media, and like people propagate that misinformation without fact checking, and it just goes crazy. So we're seeing a lot of misinformation, but we're also seeing disinformation. And so that's when people are like deliberately spreading false information just to be malicious and to hurt people, like the anti-vaxxers. So that's really been a big problem throughout this pandemic, because now we have so many people that are refusing vaccines because of all this misinformation and disinformation. So that's what I'm going to talk about with COVID. Now I'm going to move on to other public health problems because, yes.
Cases today, how does it compare to the maximum we had?
Oh, it's, I mean, I think like the maximum during the pandemic. Well, first of all, I mean, like what were the cases that I quoted today is like, it's like apples and oranges compared to the rest of the pandemic, because for most of the pandemic, people were, testing in laboratories or places where the tester had to report their results to the state health department. So we would get that information. So now there are a lot of people that are testing at home, and, we never get that information. Sorry. So what? Right. Well, but anyway, just as the recent trends, as I said, is that we're on the decline. I think with this pandemic, with this Omicron variant, I think our maximum was in the 800s. It's significantly decreased. So we just really, have to look at trends. Our hospitalizations, they're up a little bit. They're not, they've kind of like leveled off, and they're not decreasing like we thought they may have, but the hospital numbers lag from the cases, because people usually get sick enough to get in the hospital about a week and a half after they've been infected. And then and also the people in the hospital are not all Erie County residents. And however, I mean, with remember, like, last year with the Delta wave, I mean, like, we were worried that we were going to be out of hospital beds. I mean, it was really bad. I mean, the hospitals were like, 95, 99, sometimes 100% full. And they had to like just keep figuring out how to create more staffed beds. And that's in light of nurses burning out and quitting. It was just a really, really bad situation. So, I mean, it's been a lot, in the hospitals, it's been a lot worse. I mean, the hospital availability now, I mean, the hospitals are like about, 85% full now. So they still have capacity. They're not like, busting at the seams like they had been in the past. Yes. Right. So the question is about the location of our testing sites and getting prepared for the fall. Like we are just like one of, I don't know, like over 100 places probably in the county where you can get testing. So, I mean, there's like, you drive by and I mean, you should see, like drive by, like, COVID testing here, COVID testing here. There's a lot of COVID testing. And so it's not the COVID testing is not an issue of availability. It's so, I mean, what we're trying to do in the county is like, we're the safety net providers. So we're trying to be in places where, people who may not have access to the commercial testing or don't have a way to pay for it are going to be able to have access. Well, I mean, that's why we're on bus routes. And like in Cheektowaga, we're on a bus route, and there is a lot of testing available in the north towns. There, if we feel that there's a need, we'll be in the north towns, but there is a lot of testing in the north towns. I mean, there's a lot of testing.
Well,
So,
that's involved when they get paid.
Um,
I don't know if insurance pays for it.
right. Well, I mean, we'll see if there's any. We haven't heard of people in the north towns not having access to testing. I mean, right. The government's still giving away free tests. So, everybody has access to a free home COVID-19 test. I mean, the state's doing that. They're giving, and then I know they're planning another round of giveaway tests. So there is a lot of testing available here in the north towns. Yes.
Is the rapid test that you're doing at your county site, is that a rapid antigen test or is it a rapid PCR?
Right. So the question is, what type of tests are we offering at our sites? So at our sites, we are offering the regular laboratory PCR, and that's a multiplex test. So with our PCR, we also test for influenza and RSV. And then and then our rapid test is the ID Now. So that's a molecular diagnostic test. It's not a PCR test, but it is a nucleic acid amplification test. Yes.
I've been to the Cheektowaga location a number of times. It's amazingly efficient. Staff is always amazing.
Thank you.
It's really been such a positive thing. It's really worth going there for anybody. There are free tests. They don't even take your insurance information or anything like that. But also, I wanted to know if, let's say, you're on an antiviral, how long do you take these?
Well, the antivirals are prescription medications. I think they're both for 5 days. With the Paxlovid, you have to start taking it within 5 days after the onset of symptoms. And then with a Merck product, I think you have to start taking it within 7 days after the onset of symptoms. Yes. So the question is about what do we do about travel? Well, it's a personal choice, like what risk you're willing to take. I mean, I think if, especially in like the airport and on the planes or the trains, you should definitely wear a mask. I mean, a KN95, if, you know, again, they're giving those out, I think, at the drugstores too. So, I mean, you really want to use, sorry, the highest quality mask that has the best fit, and that feels comfortable enough that you can wear it for a long period of time. So definitely, you know, wear a mask when you can. And you know, I mean, you can only get a booster as they're recommended. So if you've had your 4th dose already, you have to wait for, you know, a 5th dose to be recommended or another booster. And then I think what we traveled abroad earlier this month, and what was freaked me out is, I wasn't worried about like the airport or the plane, because I'm like, I'm wearing an N95, I'll be fine. And so the problem was having to test to get negative to get back into the States within 24 hours. So I mean, I was so worried about like having to testing positive and then not like being stranded at where I was. And when we were away, there was an article published in the New York Times about a woman that was actually stranded in Amsterdam for like a month because she kept testing positive, and she didn't realize that she could get like some type of documentation that shows that, you know, she completed her isolation period of 10 days and she was, you know, safe to travel again. So she, you know, she finally figured that out. But I was, really worried about testing positive and not being able to return home. But obviously I got back. No, to travel, I mean, if for people to return from travel outside the United States, turn back into the United States, except for Canada, you can use a rapid antigen test. We used a rapid antigen test, but with a rapid antigen test, it has to be like, witness. And so you have to figure out how to do that. But I'm going to move on to another question. Yes.
Regards to the boosters, I've been in boosters. So I'm ready for my 4th one. But okay, so is that there's a different variant now? So are they going to produce a kind of shot or something for this variant, or is this booster shot is that going to help me against the Omicron?
Yeah, so the question is are the current vaccines, do they protect against the current variant? And the answer is right now, yes. I mean, it's not as effective as to prevent against infection, like transmission. That's why it's important to mask and distance. However, they are effective of keeping people out of the hospital in general. The drug companies, I mean, they have like ready there to they already have like vaccines against the Delta variant and the Omicron variant, but they haven't really needed to release them because the current version still works. What the vaccine companies are doing now is developing a vaccine, and I think they have it figured out already, that targets a different protein on SARS-CoV-2 virus that is more like universal, that doesn't change with the variants, or hasn't changed yet. And so that would be more of a universal vaccine. But I think they're doing, I think it's developed, and I think they're doing trials. It's not FDA approved.
I haven't heard about that news at all. And I kept looking for it.
So it's better for me to just get another booster instead of waiting for one that's closer to the variant.
Yeah, so the question is, like, should we wait to get boosted? If you're eligible, and my recommendation is if you're eligible to get a booster, get it.
I have no problem. Just trying to, it ripped through my company this past like month. 11 guys. And about half of them are gotten 2
Right, yeah, no, well, we know with this variant that the booster makes a big difference in protection. Yes. Oh,
Boosted, but then had one of these quote breakthrough infections. Is there a need, and is there any guidelines for how long after the infection that they should be boosted? Does the infection itself act as sort of a new?
yeah, so the question is like, how long after your COVID infection should you think about getting a booster? Well, I mean, you could get a booster when recommendation now is like you're eligible for a booster after you fully recovered from your infection. Data suggests that the infection can protect you for probably 6 months or more from the strain that you were infected with. I mean, the problem is that, if there's a new variant that's very different from the strain that you were infected with, that may not protect you from that strain. Yes.
A number of us are going on the Aviation cruise, for example, and if we're eligible for a second booster, does it make any sense to hold off closer to the trip versus they can get as soon as the other people?
So the question is, if you have travel planned in the next few months, should you wait to get your next booster until right before the travel? Well, I mean, again, it's a betting game. It's like, what risk are you willing, to incur? So again, what we know is the boosters that you get now are are effective to prevent you from getting very ill and ending up in the hospital if you do get infected. If you get a booster closer, the closer you are to your last vaccine, the higher antibody levels is and the more protection you have against an infection. So you have to kind of like weigh the risk benefits and by the time you go, there might be another booster recommend, who knows? So you just have to decide, you have to try to figure out what risk you're willing to take. Right, with the boosters, the antibody levels do wane over time. However, we showed that they still the protection against severe illness persists. It's just the protection against a new infection wanes over time. However, it seems like the protection against moderate to severe illness and hospitalization and death is persists for longer periods of time.
If you still have people who have been boosted who end up in the hospital.
Right, because I mean, the people that who are boosted who end up in the hospital have like a lot of other health problems that it doesn't take much to tip them over.
Okay. Move on and we'll move on.
Okay, so let's talk about opioids. So this is a graph looking at the number of opioid-related overdose deaths from 2012 to so far in 2022. And you can see that we really the number of opioid-related overdose deaths really started escalating in 2015. The medical examiner came to me and like, Gale, we have a problem. We're doubling our opioid-related overdose deaths this year compared to last year. And so we realized that there was a problem, and we took it to the county executive, and he's like, yeah, let's do something. We can't just watch this. So we developed a task force, and it's really multidisciplinary. We have 7 different work groups, and then from all different disciplines, and each work group kind of works in their own lane, and then we all come to and what they're best at. Then we all come together quarterly to share what we're doing, and we do a lot of collaborative work. And so we have healthcare providers, we have health education, we have harm reduction, we have substance use treatment providers, we have law enforcement, we have family support, we have health education, we have harm reduction. So it's it's a really robust group, and we're still working and meeting every 3 months. And so we peaked in 2016 at 301 cases. And then our what we've been doing has been effective. And we actually cut the number of opioid-related overdose deaths in half by 2019. And then the pandemic hit, And, everything changed. So we weren't able to continue a lot of our effective programs because of the distancing and, people being closed down, everything closed down. And then also, I mean, people were like, using alone, they were so isolated. They were like self-medicating because they were like depressed and unemployed and alone. And also we started to see more like other drugs being, spike with fentanyl. So now, I mean, and especially now, we're seeing a lot of people, like a significant, like about 40% of our opioid-related overdose deaths have cocaine and fentanyl in their tox screens. And the scene investigators say that, like, when they come to the death scene, there's like white powder all over the place. So the person looks like they think that they're using cocaine, and it probably is some cocaine in it, but there's also fentanyl in it, and they're just not prepared. So we're really, we've always been trying really hard, especially after the pandemic, with harm reduction approaches, get Narcan, don't use alone, know how to use the Narcan. And so we've, really been trying hard with that. And recently we've had a burst of opioid related overdose deaths. And I actually did a press conference today with our county, our DA. And actually, since May 13th, there have been 12 deaths among Erie County residents that have suspected to have cocaine and fentanyl. And that's not counting the other opioid-related overdose deaths, but 12 of these deaths were cocaine and fentanyl. And so we're trying really hard to emphasize harm reduction. So, I mean, we're like, just by advertising, like saying you shouldn't use, I mean, that's not going to change people's behavior. So like, how can people, still use and be safe? So we're really encouraging everybody to get Narcan, and we're giving away free Narcan. We have a program called Text for Narcan. And so, people can text the number, and it's on our website. And then the only question asked is, how can we get this to you? We've been placing these like Narcan emergency boxes with, like in all these public venues and like restaurants and bars. We have a new campaign. And so, you open up the glass box and there's a dose of Narcan in it. We're also, encouraging people, not to use alone, or if two people are going to use, like one person should like wait to use until, so that they can observe the other person, and call for help if they need to. And then we're also giving away these test strips, so you can test for fentanyl in it. So you can test your cocaine, and if it does have fentanyl, I don't know if they're gonna not use it, but hopefully they can just like use like a small dose and see what happens. And then also we're still trying to encourage people to work with peers and, eventually to get into treatment. And we have our addictions hotline at 716-831-7007. You can call and get information, and you can even get linked like to a treatment provider, and you can even get like, your first dose of medication assisted treatment on the phone, a prescription on the phone, and then linked up to a long-term provider, get an appointment, and then and get linked up with a peer. So we have a program that we work with the emergency departments called New York Matters. And so if if someone is ready to start medication assisted treatment, they can either go to the emergency department or make a virtual visit. We're recommending a virtual visit, and tell the emergency department they want to speak to a provider to participate in New York Matters. And then they'll do a visit for substance use disorder, and they'll, if the person is willing to start medication assisted treatment with buprenorphine, they'll send in a prescription right away for a 2-week supply, give them their first appointment with a long-term treatment provider, and link them up with a peer, and also get them some Narcan. So we're, trying hard to get people into treatment. And so as our new program, as I mentioned, is we're really trying hard to access people in the community. And so since the pandemic, like everybody's been going out to restaurants, like people are really hot to go out to eat. So we are working with our community restaurants and bars, and we're offering them free harm reduction material so they can have in their restaurant and bar. So, they're, we just started that, and I think hopefully the restaurants and bars will start to order this stuff. And then other health, so does anybody have any questions on the opioids?
We have thoughts on having a legal way of buying cocaine.
How to do what?
Legally buy cocaine, if you know what the purity is.
Oh, so the question is, what do I think about making, I guess, legalizing cocaine? My answer is that's up to the legislatures. Nobody, like it doesn't matter what I think. Any other questions? No. Okay, so influenza. So, usually like flu season is in the winter, and usually like we peak with influenza like later in January, early in February. So during the pandemic, we didn't have any flu because everybody was masking and social distancing and washing their hands. And so that prevents COVID-19. It also prevents influenza. So this year, after we removed our masks, we started seeing flu again. And then during Omicron, people put on their masks again over the winter. And so then flu went away again. And now when people are removed their masks, we're starting to see another wave of flu. So the brown line on this graph is looking at the number of influenza cases reported to New York State. And the brown line is what we saw in 2019 to 2020, so before the pandemic. The blue line is the year before that. And then the green line that you can barely see, it's just like hovering along the right above the X curve is because it's almost zero, is during the pandemic, we had like no COVID. And then the red line is this past calendar year, so 2021, 22. And so you can see that, we peaked in the winter when, early winter when we all removed our masks. And then Omicron came, everybody put their mask back on. And then as you can see on the red line, we went down again. And then, and now everybody's removed their masks and we're seeing more flu. So if you haven't gotten your flu shot, we're still recommending getting your flu shot because now the flu season is really off, and it's really going to be difficult to predict when we will peak with flu.
How effective was the vaccine?
So the question is, how effective is the flu vaccine? Like, I don't even know because I don't really think that they were looking at that very much. I mean, I know they're looking at it. I don't know. I mean, it's usually around like, like a good year, it's like between 50-60% effective at preventing infection. And however, like 50-60% is a greater number than 0%. And if you do get infected, people who are vaccinated with influenza vaccine, just like the COVID vaccine, are more likely, not to become very, very ill once they are infected. Any other questions? Okay. So another public health problem, as I mentioned, that came light from the pandemic are health disparities. So at the end of last year, we were able to pass a law, and we opened up in Erie County the Office of Health Equity. And so, we're really trying to right now, with any new public health problem, what you have to do is measure it. Like, where are we? How bad is it? What are the key variables, the key contributors, and the circumstances to better understand it, and then figure out, well, what can we do to change this and make this better? So, right now we're collecting data and trying to figure out, where we are with that. And then we're also kind of, building bridges to work with community partners. So once we do figure out like where we are and where we need to go, and looking at programs that work, and maybe even conducting some pilot projects ourselves, we'll have some great community partners to work with. Because like a challenge like this, just like any public health problem, really need good community partners. So we're focusing on that. Any questions on that? Okay, now I'm going to move on to sexually transmitted infections. So we've had this like, again, mushrooming of sexually transmitted infections during the pandemic. We've seen huge increases in gonorrhea, huge increases in syphilis, including congenital syphilis, which is 100% preventable. If you have congenital syphilis, That means it's like a total failure of the healthcare system and the public health system. There should be no reason you have congenital syphilis. And we've also seen a significant increase in new HIV cases. So with our new HIV cases, we had a 41% increase in 2020 compared to 2021. Many of these individuals were young, under the age of 25, history of male-to-male sexual contact, people of color, and also lived in the city of Buffalo. And then also, we just compared to the regular population, there was a higher proportion of people who had transgender experiences. So here I'm looking at our gonorrhea cases on the left and chlamydia cases on the right in Erie County. Sorry, the colors didn't, I don't know, the colors didn't come out on this slide. Erie County is the higher line and the city of Buffalo is the lower line. And looking at the data from 2015 to 2021. So in 2020, we had a 56% increase in the number of reported gonorrhea cases compared to the year before. And about 80% of the gonorrhea cases in Erie County are among residents in the city of Buffalo. So, so that, that's been a big problem. In chlamydia, you can see that actually during the pandemic, the numbers decreased, but we think that that's because there are less people that got tested. Because unlike gonorrhea, where many people are symptomatic, especially men are symptomatic, and so they go in and get care and they get tested, and we know about it. With chlamydia, it's usually asymptomatic, and most of the infections are among women that get routine chlamydia testing as part of their preventive care. And we know that a lot of people were foregoing preventive care during the pandemic. And so we think that there's still like a lot of chlamydia around, just like there's a lot of gonorrhea around, but we're not finding it. And then these are looking at our syphilis cases, including congenital syphilis and HIV. So you can see that on the top bar or chart that that's early syphilis, which is the most contagious form of syphilis from 2018 to 2021. And you can see in 2021, we like doubled the number of cases compared to 2020. And then the next table is looking at the number of congenital syphilis cases. And last year we had 3 cases. We'll probably be even higher than that this year. So that's that's really, really sad. And then there, the bottom is looking at the number of new HIV diagnoses from 2018 to 2020. And you can see that 104 is a higher number than 79. So we're also increasing there. So this is, another problem that we have. But we have some innovative projects. Oh, yes.
Understand how it's so bad. How are we saying what's happening? It's not going to the doctor, going to the doctor too late. We've become even more promiscuous and crazy, like unhealthy ways, and messages are getting out. Like, what is causing this?
So, yeah, so the question is, what's causing all this? So actually, I think it was last week, Ed Dranch wanted to interview me about what we're seeing with HIV. And he's like, so doctor, don't you think that we're seeing more HIVs because more people shacked up during the pandemic? I'm like, well, Ed, I don't really have data to support that hypothesis. That was really weird. Especially he was on TV. So I think it's a combination. We weren't getting out the prevention messages. Like, people didn't go out and get access to condoms. People were really desperate and lonely, and maybe hooking up with people they didn't know very well. I think there were. Probably it's multifactorial, but we weren't out there in the community doing the prevention work that we normally do, and that's this is the effects, especially with HIV, because we have now you can prevent HIV with pre-exposure prophylaxis and Truvada, and although we still were offering virtual PrEP clinics at the county, I think a lot of people were just shy of getting any type of preventive care. So what we're doing now with we have a virtual expedited partner therapy service. So expedited partner therapy is when the partners of people who are infected with STIs are able to get medication to treat their exposure to STIs, because we know that many people who have STIs, they get, even though after they're treated, they get reinfected pretty quickly. It's because their partners have untreated infections. So even those individuals who get diagnosed, get treated, they just then they go back and have sex with their partners who aren't treated, and they get reinfected. So expedited partner therapy is treating the partner, and so then the partner will get treated too, and the person will get reinfected. And so what we're doing now is offering virtual expedited partner therapy. So we don't even have to know, I mean, New York State, you don't even have to know the partner's name. You can write in the prescription for expedited partner therapy, and it's legal for the pharmacy to fill that. So we're letting people who have been diagnosed with an STI, and we can see that through our health department surveillance data, like call up or come to our clinic and say, you know, I want expedited partner therapy for my partner. And so if they come to our clinic, we'll give them the medication. If they call up, we work with a mail order pharmacy, and we have the medication mailed to them. So this is a proven, expedited partner therapy is proven to decrease transmission. And so we're the only county in New York State that's offering this virtually. And then any questions about that? Yes.
How do you know the partner's not allergic to the medication?
So the question is, what about drug allergies in the partner? Well, the medication that we use has, you know, I mean, we have, first of all, well, the medication we use is very, very low risk for anaphylaxis. And we also give information that to counsel the person that takes the medication, you know, warn them about drug allergies. But with the medication that we use is like azithromycin or doxycycline and cefixime and Flagyl, that has a very, very low incidence of anaphylaxis. Any other question? I mean, like, that's never happened before we know of in STD land. Okay, so monkeypox. So this is the new I guess communicable disease on the block. We don't think it's gonna get to a pandemic phase because it's not easily transmissible. So it's really a rare disease, and until this current outbreak, we've never really seen human to human transmission. So this is very, very rare. So it was first discovered in the late 50s and was first recorded in human in 1970. And like most of the cases are in Africa, in the Democratic Republic of Congo. And it's very similar. It's the same type of strain of virus as smallpox. And so this is a picture of the pox, the pox rash that it can cause. And you can see that they're slightly umbilicated, like there's a little like blip on the top of the pox. And so that's kind of specific for monkeypox. Yeah. Well, can I finish talking about monkeypox before, because I might answer your question.
Yeah. A lot of us had were vaccinated against smallpox long time ago when we were in grade school. We just went to school and they did it. We have this like a mark on it. Is that still protecting us against?
Yeah, so the question is, will the smallpox vaccine that we received a long time ago be protective against this monkeypox? And I know that the more recent smallpox vaccines are supposed to be protective against the current monkeypox, but I'm not sure like what the durability of immunity is from the smallpox vaccine that we originally received. So I'm not sure what the answer to that is. CDC scientists are tracking like multiple cases that have reported of monkeypox that are reported like around in the United States, and also WHO is following that internationally. We're seeing the largest number of cases are in Portugal, Spain, and Canada. And we do have some in the US, and there are some other cases in Europe. So we're not really clear exactly how monkeypox is spread, but we know that it's like being in close contact with somebody for a long period of time is the way that it's spread. It may also be spread with some droplets, but it's, we don't really know the exact mechanisms. We know it's people have been in close contact for like a long period of time, not like SARS-CoV-2, where you just have to be in contact for like, 10 or 15 minutes. But this one, you have to be in close contact for a long period of time. And we're seeing it more in the United States right now among men who have sex with men. And, it's not clear if that's who we're doing contact tracing, that's who we're identifying, but we're seeing it a lot in men who have sex with men right now. So, it has this typical rash. And so, we're trying to, we've alerted healthcare providers, the CDC and the state have alerted healthcare providers. So if, if somebody who has a rash that looks like monkeypox, then they've had other systemic symptoms like fever, swollen lymph nodes, tiredness, and they have like a contact history or a travel history, then that's something that we would want to investigate. And the testing is complicated. Like right now, what they do is the state will test do a PCR testing of the lesions for orthovirus, which is kind of the larger family of viruses for smallpox. And then if it tests positive for orthovirus, then they send that to CDC, and the CDC has the monkeypox tests to use.
So they tested to determine if the virus has changed from the original 1970s version versus today?
We believe that it probably has changed because it's it's more transmissible in humans, but they haven't, I don't think they've sequenced it yet, and I don't think they've characterized it because I haven't heard about that. So this is looking at the number of confirmed cases in each state. So there hasn't been really a lot in the United States, and the New York State is from New York City.
Yeah, I know, that's what worries me.
I'm sorry, what?
If you were given this clock in January 2020 or February 2020, you'd be showing numbers like this.
Yeah. Right. Well, again, with the investigations that they've done so far, it seems like people really need like a lot more closer contact for a longer period of time, kind of like, TB. So, this is if you want to know more about what we're doing in Erie County, we have a website. We're also on social media. So invite you to check us out. So I think that's all I have to say. Oh, and we have a lot of COVID-19 information. We have we have an information line. We have a lot of information on our website too, or you can call up and ask questions. We have a map where we map out cases, and then we have vaccine clinics. And I told you about our testing clinics. So yes. So the question is like, what do I expect in the fall? Well, we expect that we're going to see, high cases. Seems like the variants have been, when they mutate, they become even more transmissible. Like each variant has been more transmissible than the last one. So, so we expect that this next variant, whatever comes in the fall, is going to be even more transmissible. And, we don't know what level of illness it'll cause. But we know that in the fall, like so far in the fall, like the past, two falls in 2021 and 2022, when it started to get cold and people returned inside, our numbers really increased. Also in the fall, kids are going back to school, returning to school, and kids are infectious disease vectors. So they'll go to school and we're seeing a lot of infections in the school, and then they bring it home to their families and to sports. And we're expecting to see very high numbers again in the fall. So right now, our goal over the summer is to really, plan for a robust public health response in the fall. And you had a question?
Yes, you go into a restaurant, they tell you wear a mask, Then you sit down and you eat. So if you have COVID, the germs are floating around. And then you stand back up and you put in the bathroom, you better put your mask back on. Doesn't it seem that you go in a restaurant?
So the question is like, what, does it make sense that you walk into a restaurant and you wear a mask and then when you sit down, you remove your mask? Again, it's the risk you're willing to take. When you're sitting down at a table, you're not mixing with other people. You're just staying around the people at the table. And, hopefully there's, fairly decent air circulation in the restaurant it's still you'll be at risk of getting infected if there is somebody infected with somebody sitting close to you. So hopefully you can, figure out, go to a restaurant where you're not like sitting on top of each other and, eating outdoors is safer than eating indoors. So especially when the weather's nice, we, try to go to restaurants outdoors. So, I mean, again, there's no situation that is no risk. And so you have to figure out like what risk you're willing to take and, what can you do to minimize your risk with the activities that you enjoy?
So if someone with COVID walks down the hallway, they're breathing, stay in here.
Well, again, it depends on the like where you are. So outdoors, it's probably negligible. If you're in a place that has like good air circulation, even like an open window or like their HVAC has like MERV like 11 or 13 or above, that's very protective. So if you're just around them for a few minutes, it would be unlikely that you're exposed. But everything's different. I can't say there's no risk. There's, you're looking at levels of risk. So, if you have a mask on, that's more protective. If like you're only next to the person for a couple minutes, but the person is coughing, that's higher risk. Or so, you have to take a lot of factors into account.
Hey, doctor, what type of mask are you wearing?
So, sorry, I have a question from Ed. So when, again, it depends where I am. So if I'm outdoors and there aren't a lot of people around, I don't wear a mask or I know the people I'm with, I spend time with them, I won't wear a mask. If I'm outdoors and it's a crowded situation, I'll wear a mask. And what I'd like to do is I double mask. So I wear a surgical mask, a procedure mask. But the problem is with those masks, they usually kind of open up on the sides, they don't fit that tightly. So then I use a cloth mask on top of that really, and I pull it tight. I have like something like a toggles on the back ears that make it full tight to my face. And that's where, oftentimes what I'll usually wear, if I'm traveling, I'll wear an N95 or KN95. So, again, it kind of depends on the risk. I mean, that's what I do, but my husband, like he'll just wear like a cloth mask or procedure mask when we go out, socially to like the theater or the Buffalo Philharmonic. But, whenever we travel, which isn't that much, but if, we do travel, we will definitely wear N95s or KN95s. So the question is, like, what is in our stars with COVID? Is this going to go away or is it going to continue mutating? And I think, every scientist feels certain that COVID is here to stay. And, we just have to, because we're not going to get universal vaccination. And so it's always going to be here. So we have to figure out, like, how do we make it work? Like, how can we continue engaging in activities? We can't like close everything down again. That's not going to work. So, so now we focus just like on substance use disorder, like harm reduction. What can we do to mitigate the effects of COVID? And hopefully by, reducing the risk of transmission, like wearing masks, even though it's not mandated anymore, it doesn't mean you can't wear a mask. It means, you still can wear a mask just because you don't have to. And then, private facilities can make their own rules, and like here, we're mandating masking just to keep everybody safe. And then, getting vaccinated and making sure you get boosters when you can, and, avoiding really crowded places. And, it's not going to be back to what it was before the pandemic ever again. Well, this is always going to be a thing, and we just have to try to do what we can to minimize our risk and engage in harm reduction and figure out like what risks are we willing to take. So say like a 20-year-old who has no other health problems and who's fully vaccinated is probably not going to get very sick if they are infected, and they'll bounce back and recover. But somebody who is a senior who has like COPD or high blood pressure, or diabetes, that individual has to really be careful about getting infected, because even if they are fully vaccinated and boosted, like depending on their level of health, they could still be at risk for some negative consequences. Yes. Well, so the question is like, how do people present with COVID? Well, it's very variable. I mean, so we know they're finding that people are asymptomatic to, some people get, very sick and end up in the hospital and die. So it's very variable. The typical symptoms are, fever, like respiratory symptoms, like, coughing, congestion, seeing a lot of like sore throats. So it's usually like a respiratory symptom, but again, everybody's different. Is there any questions from my virtual friends? You want to feel like you're being ignored.
Is there a phone number ever to call if, we wanted like a hotline just to listen to current updates of what you're saying, Gale? Because this was excellent. Thank you so much.
Oh, thank you. Well, on our Erie County COVID-19 website, we have like updated information. But the county executive and I used to hold regular press conferences. Those would be live streamed and recorded. We're not holding those press conferences anymore. However, we have maps and we update our data, case numbers, we update that weekly.
I don't use the internet. Is there ever a telephone number that would have a recorded message, or a person there, like a clerk level, that can dispense a brief?
Well, we have a hotline, a 716-858-2929, and you can ask them questions.
I'm sorry, 85. What was it? 716-858. Yes.
2929, and you can ask
2929. Thank you.
Yeah, sure.
My name's Donna.
Oh, hi,
Thank
Donna.
you.
Thank you.
Go ahead. I have one question I can ask you, Gale.
Sure.
I think I read something about long COVID not being prevented by vaccination. Is that, you know anything about that?
Yeah, I mean, we are finding that there are people who develop long COVID, and again, there are varying degrees of long COVID that have been vaccinated. So it's, again, I've also know that there are people who don't get that sick with their primary COVID infection that have, suffer from persistent symptoms and are categorized as long COVID. So it really, again, vaccines are not 100% protective to prevent long COVID, although we know that, again, in general, the outcomes of COVID are better if you're fully vaccinated and boosted, but nothing's 100%. Also, they found in the literature that, kids who are fully vaccinated are less likely to develop MIS-C compared to kids that are not vaccinated.
Thanks.
It's a multi-system multi-inflammatory system from COVID. And so it's this general multi-organ inflammatory syndrome, and kids can get like really ill. I mean, they get very, very ill, and those are the kids that end up in the intensive care unit. Oh. I don't know, I lost them. Well, it looks like we were done anyway. Oh, no, here they are. I don't know what that was. You're back. Sorry, we lost you for a second. Anything else? All right, well, thanks for your interest. Thanks for listening, and have a happy and safe Memorial Day weekend.
Thank you.
Thank you.
Thank you.
Thank you very much.
Bye.
Yes,
Doctor.
thank you.
Okay, bye-bye.
Really wonderful.
Bye, everyone. Thank you for attending.
Hi, Joanne.
Bye-bye.